So, as often the case on a Saturday morning, we're speaking to virologist Chris Smith and Linda Bauld, who's Professor of Public Health at the University of Edinburgh. Very good morning to you both. And there are some dreadful words attached to this, because these are people, these are families, these are stories, aren't they? These are people's lives. And I just wonder, you know, number happened that we heard we'd reached that point.
Obviously very, very sad. It's a terrible milestone, a grim milestone. But at the same time, I was buoyed up by the positive messages this week, some of which you just alluded to. We had not one, but two new vaccines which have got to the stage of phase 3. So they're showing positive results, and that will enormously buoy up our ability. Is absolutely outstanding. And, you know, I, as a hospital doctor, was able to go and get my vaccine last weekend. They recognised me in the queue. And backstage, all the vaccinators were drawing lots as to who was going to shoot up the guy they see on the telly. So they did a great job. So I think that it was a week of contrasts.
I think your program actually earlier in the week, when we hit that 100,000 figure, was talking about the people who'd lost their lives, the preventable deaths, telling some of their stories, and I think that's really important that we do reflect on that. But Chris is right. We've got I suppose 3 stories here. The first one is the tragedy of what's happened in this country, and we'll be looking back and asking questions and saying, where did we go wrong? Secondly, the realization that actually we're nowhere near out of the woods, and I'm sure we're going to go on to talk about where we are now with the data and the figures, and we absolutely have to stick with the current framework we have and the public health measures. But then, as Chris says, the really phenomenal progress that the UK is making ahead of everywhere in Europe, and only a few other countries have rolled out the vaccine more quickly than we have. So there's certainly at least three stories here, and you know, I think we should try and remain positive even though we're in a very difficult situation.
OK, Linda, so let's pick up straight away with is rolled out. Can I refuse one of the other vaccines in favour of it? Linda, do you want to pick up on that?
Sure, Charlie. Well, I don't think people should be swithering about which JAG to get. It's not, you know, like choosing between different consumer products, for example. I think we have to recognise that if we're offered an appointment, we should take it up, and that all of these vaccines, I mean, it's phenomenal the rate at which science is delivering effective, safe and effective vaccines. Now, the question might be about Novavax, because of course it was reassuring to hear that it's effective against this variant, or one of the variants, the one that we've been paying most attention to here in the UK. But it's important when someone gets an appointment that they go, and any of the vaccines that they're offered, as I say, are effective. And the concern is that if you delay, you're delaying potential protection for yourself. So it's important that people take up that offer when it comes to them.
It's probably worth saying or noting, Chris, that actually there are lots of medicines that we take in our day-to-day lives where there will be slight variations amongst them from the different manufacturers they come from, depending on what medicines are prescribed for us, but they all effectively perform the same function pretty much in the same way with the same efficacy. So I suppose that's maybe one way of looking at it. Would that be a fair comparison?
A couple of points there. First of all, remember that the 3 vaccines licensed at the moment in this country are Pfizer's vaccine, the AstraZeneca vaccine and Moderna's vaccine. We're not expecting to take delivery of the Moderna vaccine yet, so there are 2 shows in town at the moment. The announcements this week of the Janssen vaccine and Novavax's vaccine, they are results of phase 3 trials, but they've yet to submit their application to our regulator, the MHRA, so they haven't been approved yet. And looking at the timeline that's being proposed, it will be probably midway through the year before they're available in the country. So at the moment, if people get the call, please come and have a vaccine, do please go and have a vaccine. Don't delay, because it's now that we've got very high levels of virus circulating in the community. Still, probably about 1 million people around the country are infected with this at the moment. 1 person in 55. The numbers are beginning to come down, and that's very encouraging. Depends. If you're buying a packet of paracetamol, there's an enormous amount of marketing and branding on that packet. But if the molecule in the pill inside is paracetamol, it's the same molecule regardless of what box it's in, and there's a healthy helping of placebo effect in there. So do watch out. There's no placebo effect with these vaccines. Different vaccines work in slightly different ways and contain slightly different constituents, not the same as a packet of paracetamol.
Gotcha. The same manufacturer, which clearly some people will be concerned about.
Yes, especially in the wake of the posturing from Europe. And obviously we're waiting to see where that goes, although we are being reassured by the Prime Minister and others that there shouldn't be any problem with accessing the vaccines. At the moment, the plan is that everyone should get 2 doses of the thing that they got first. So if you had a Pfizer vaccine, you should receive the 2nd dose of the Pfizer vaccine. What happens, though, if that can't be accessed? Well, the answer is that, as far as we know, the trials haven't been done, but as far as we know, and based on what we know about vaccines in general, were you to come along with a second different vaccine the second time, actually, it might not be such a bad thing. This is actually dubbed heterologous vaccination, a long word, but it basically means vaccinating you with 2 different products. And there's evidence that may even translate into a more resilient, more powerful immune response in the long run. So.
Well, you're right. So, Charlie, Fridays are always a very busy day because we get a lot of data released on a Friday. And so just to take you through there, I think we're seeing an emerging picture of where we are. If you look at case numbers, they're definitely declining. And in fact, over the last few days, we've even seen slightly fewer people in hospital and ICU. But we get these population-based estimates of where we are, often on a Friday. And Chris has already mentioned the ONS infection survey, which shows that around 1 in 55 people in England, that is over 1 million people, still have the virus, slightly lower in other parts of the UK. And what you can see from there, and also the REACT study, which came out at the end of last week as well, is that is not a big decline from the previous week, for example. So it does look like it's leveling off. But then if we move to the R, which is an estimate, you can see that that has gone down. So for example, it's 0.7 to 1.1 now, released yesterday. The week before it was 0.8 to 1.0. And in terms of the growth rate, nationally, it's not growing anymore based to the R. So I think the sort of overall assessment is that we are making progress, but it's very slow progress and it remains fragile. And as you say, sadly, the mortality rates are not going to decline for a while. So it means from a public health perspective, we have to continue, unfortunately, with the restrictions that we currently have, really to try and accelerate getting the prevalence and the incidence of the disease even lower.
Yeah, I find that that's from the vaccine rather than from lockdown.
Exactly right. Very, very difficult to disentangle the thing. The 2 apart. The key thing about science is that you vary one thing at a time, keep all the other things the same, and then look for the difference. And if you vary lots of things at the same time, and we've got lots of things going on, of course, we've got lockdown, we've got the seasons changing, we've also got the virus changing. There are many parameters in play here, so it's very hard to pin this on just one thing, I would say, for a few more weeks yet, because as those numbers climb and as people's immunity builds, then we're going to really start to put a barrier in the way of the virus. And let's hope that happens probably by mid to late February.
Last question for Linda. Are they daffodils?
Yes, they are. So another sign of hope and of spring. And I certainly noticed that the mornings are getting brighter here. And so we can see that the seasons inching forward, a bit like the progress we're making on addressing the pandemic. The seasons are changing very slowly, but they are, and that's good news.
It's good to have a marker, you see. We can look every week. You see, Linda's going to give us a marker every week.
I know.
Can see where we're going.
I did note the daffodils, and that was certainly one you knew the name of, Charlie. So that's
why I'm showing up. That's why I said it. It's the only reason I said it, because I knew the name. Last week I was caught out rather badly. Did you notice them, Chris?
No, I didn't notice them, but I shall have to up my game for next week. I pulled snazzy out of the hat last week. I had a whole slew of long words I could have tried to come up with this week. You didn't give me the chance, but I'll try on the flower front next time.
Yeah, and that's because you can't see me when we're on at the same time, so we might have surprises for each other because we can't see each other.
Thank you both.
I'll see you both this morning. Thank you very much.
It's always good. Dr. Chris Smith, Professor Linda Bauld.